probably hasn't been a week recently where the news hasn't covered social isolation. Then following the social isolation theme, the Close Encounters project, Alex Massey from Age UK Portsmouth will be giving a talk about that project, and that's a partnership project. Then we've got Peter Stokes from Hampshire County Council talking about increasing social connectivity in Hampshire post-COVID-19. And then we've got Kelly Payne from the Campaign to End Loneliness giving a really interesting discussion, very brief, but about research that's taken place around the psychology of loneliness. So really, really interesting guest speakers and themes. And at the end of each of those guest speaker presentations, I will give you a chance to ask a couple of questions if you choose to do so. Right at the end of the webinar, I'll confirm the date. And as you go along, can you have a little think about what themes you'd like the Hampshire Isle of Wight Social Prescribing Network to follow through perhaps next year? I'm also open to ideas for themes for December, but I've got a couple of ideas I'm going to float with you. So as you go through the hour, please have a little think about what themes you think would be really interesting and valuable in 2021, please. So I'm going to hand over to my colleague, Tim Horton.
Thank you very much, Angela, and good afternoon, everybody. It's great to see such a wide-ranging representatives from such a wide-ranging group of organisations again on our Hampshire and Isle of Wight Social Prescribing Network event. And thank you very much to Angela for again all for the hosting, organising, and facilitation. I'm actually just going to speak for just a few brief minutes by way of really setting the scene and giving an introduction on behalf of the kind of, the work that some of the voluntary sector have been doing through the COVID lockdown period and more recently, and just give you some reflections on some of our experience. And I know this will resonate with some of you, and some of you probably could create 2 or 3 slides with similar or different points as well. But I think the first thing that I wanted to kind of highlight is that it actually, what COVID has really taught us in the voluntary sector is it doesn't take a lot for people to feel isolated and alone. What it did was really bring to the fore the fact that there's a significant cohort in our local populations, in our local communities that are just about managing, that were probably reliant on 1 or maybe 2 friends or very close family members to help them in times of need or on a regular and ongoing basis. And when that very, very limited support network was taken away or wasn't accessible to them, they were alone and isolated and were wholly dependent on the kindness and voluntary effort of strangers. And that's a very fragile and exposed place to be. I think that's really at the nub of what we're talking about. But the fact that there were perhaps a lot more people that needed a lot more help than we would have envisaged is something that I think is really, what we are trying to tackle and address through isolation. Important thing to remember, and particularly our experience of working with volunteers that were perhaps sort of exposed to some of this for the first time, that really what COVID-19 has done is exacerbated what is already, and it was already, an entrenched and very deep-rooted societal problem. Isolation hasn't been caused by COVID. It's brought it to the fore and just highlighted what an issue it is, but it's something that's much more prevalent in society before COVID and sadly will exist post-COVID. The risk is post-COVID that we need to learn lessons of what we found and try and do something differently to really address some of these problems and prevent some of the longer term impacts that isolation is already and will inevitably cause. It's the picture of isolation, I suppose, in our heads sometimes is an older person sitting alone in their home, perhaps not with a great deal of money. Actually isolation impacts all walks of life. It impacts men and women. It impacts people who have money and are actually quite wealthy, as well as people who sadly don't have a lot and maybe do live on or just above the poverty line. It affects people in urban areas. In fact, some urban areas we know people can feel incredibly lonely, despite the fact that they're living in close proximity to other people. But of course, geography and rural communities, we saw a lot of issues of isolation, of people being very much on their own and feeling physically as well as emotionally cut off from even people that lived maybe a few hundred yards away as their nearest neighbours. We know that unemployment is a big factor in isolation. If we all think ourselves how much time we spend at work and how much interaction we have outside of our families with our work colleagues, I know not so much, and most of it's via these sort of Zoom and Google Hangouts and other virtual calls at the moment, but it's still interaction. It's still meaning that we're talking and engaging with a number of people on a daily basis. Young people is really interesting, and just some stats there that we've got a stat that says that loneliness affects 31% of 18 to 24-year-olds. Of course, these are people that are self-disclosing, compared to only 17% of those aged 55. So quite an interesting and high number of young people, or people in that younger age group, particularly moving from childhood into adulthood, are experiencing loneliness. And there's an interesting relationship, therefore, with the role of digital technology, because on the one hand, we can argue that digital technology is part of the solution to loneliness, and we saw that again regularly during COVID and during the lockdown. But if it's still impacting a lot of young people that are wholly reliant or dependent on digital technology and social media, then clearly it's not the solution. And people can still feel isolated and alone despite being very well connected or having a lot of interaction via social media. And of course, there's lots of studies that suggest that the harm that social media and the falsehood, that correct word, the false sense of security that social media can give to young people around interactions. It's not the same as seeing people. It's not the same as talking and having that engagement with people face to face. We all know, I'm sure, around this room, and there'll be some good examples drawn out, with isolation. We saw some examples through the COVID lockdown that it causes much more complex problems. It's an underlying issue in many mental health needs that we saw with people, volunteers that were helping people who experience mental health needs. And we know that it exacerbates and contributes towards poor physical health. People who are alone maybe don't move as much as people that have better connections. And the fact that people were in lockdown as well and alone in their own homes, often in quite small homes and accommodation with not a lot of space to move about, meant that people's physical health, particularly some older people, deteriorated at a time when they could least afford that. The whole kind of concept of the term that was used throughout lockdown and throughout the COVID-19 period of social distancing, and of course it still is used, and very, very important that we maintain distancing, but it's a bit of a dichotomy. So what we do need to do is stay physically distanced, but really important that we encourage people to be and keep socially connected. So when you talk about social distancing, it can imply that actually you mustn't talk to anybody, you mustn't engage, you keep our physical distance. So I'm not suggesting we suddenly start to unpick government policy and come up with our own terms and, start to undermine the key clear messages that need to be given. But I do think we need to nuance that. And there are some groups that we're seeing that have always sort of taken an extremely cautious view that it's not safe to engage and even sort of, certainly, talking online or interacting in any way, shape or form is going to present a risk. And we do need to keep emphasising that message of the importance of social connectivity. And really, we're going to hear this afternoon from Alex, from Peter and from Kelly, I'm sure, some really interesting thoughts and examples of what's worked, with some challenges as well. And there are, so many examples out there from quite simple sort of befriending services. We'll hear, the importance of getting voluntary sector activity restarted. We know that in some social prescribers have actually found it quite difficult in recent weeks, because actually you've got the patient cohorts coming through GPs and primary care and other NHS referral routes, and indeed through adult health and social care. But there's not necessarily the capacity in the voluntary sector yet. We're not able to restart as many services as the demand is there for. And also we need to keep older people and vulnerable people with health conditions still safe. So while shielding and other restrictions have ended, actually people just jumping straight back into going to daily clubs or weekly clubs and activities sitting cheek by jowl with people is not something that can necessarily be done. So there is a little bit of a lag now between getting groups and services back up and running, and that's something that we really need to be aware of, but equally not be as scared that we can't do to take proactive steps to start reconnecting people. What a new normal looks like, we don't know, but we must keep it, front and centre is that importance of being able to reconnect people, being able to keep in contact with people, being able to talk to people, and being able to reassure people that over time it is safe to go out, that we can manage some of the risk, and we can really help them to deal with some of that risk so that they can start to re-engage with society. And it becomes a balance of risk, and we've got some of this in some of our services at the moment, between where is it a greater health risk to keep people in isolation over and above the risk of COVID, and where does the risk become more balanced or more nuanced so that actually that outweighs the risk of them actually going out and reconnecting with people. I'll leave it there. I'm sure through the there'll be some questions that's come up through the speakers as well. If there are any immediate questions, then I think there might be a minute or two, Angela, to allow for that.
There is, yeah. So I would open it up to our attendees. Are there any questions? Again, if you are wanting to ask a question by phone, please make yourselves known. There's about 4 people, I think, joining by phone now. But equally, if you'd like to ask a question via chat, I've explained where the chat box is. So I'll just give you a minute to see if there are any questions, because I'll need to keep an eye on chat. And if not, we'll move forward. So it's open to yourselves for any comments, observations, or questions. So let's have a little look.
I can see one from Julie asking about an example of a group that has reopened for older people. There's a couple of things I'd say on that, Julie. Is I think that, and apologies if there's somebody on the call who's going to contradict me, but I believe that certainly groups like Brendan Care have been doing a lot of really valuable work during COVID in securing additional funding to run some COVID safe activities. Some of that's about digital inclusion as well as actually face-to-face. But there are some organisations like that have been able to. Just an example is our own and many others in the county have restarted since July. I can see Sam is on the call. So
yeah, I'll call Sam in a moment. You carry on, Tim, and
it's the transport services. So again, things like Dial a Ride and Call and Go services have restarted. We're at about an approximate, and I know it varies across the county, about 50% capacity. We've got safe transport for older people to get out and about and to interact, respecting all of the COVID restrictions and the safety requirements, both for our own drivers, but also for the passengers, with limited seating capacity and social distancing. So I think there's a general move, and there are some really good sort of template risk assessments, a lot of help out there, particularly from the CVS network, around risk assessments that can be carried out for older people's groups. So although each to their own, it's not to say everybody should be able to reopen. It's certainly the question that needs to be asked as to when it's safe to do so, what needs to happen to the venue. And it's not the case that we can't start to reopen some of those older persons clubs and activities, respecting some of those distancing requirements.
Thank you. And that's a really nice link into Sam. Sam is from Brendan Care. So Sam, would you like to just comment on that, please?
Yeah, just a quick update. So we obviously closed all 94 clubs, and we've been doing telephone support and digital connections and virtual clubs. As of next week, we are just about ready to start piloting some very, very small, very well supervised clubs to reopen. They'll be staff-led. Initially, we'll be running some sessions, some support sessions for volunteers to get them confident again. But we're not going to be at the point where they're going to be leading groups. The staff will be leading the groups, and they will be looking a little bit different to normal. But we have 4 venues that we're working with so that we can at least get something going and start learning from that. But it's been a really, really big piece of work to get to this point.
Lovely. Thank you very much for the update, Sam. I can see Debbie Ross from Open Site. For those of you that are joining by phone, I'll try and update you about the chat comments. So she said that she'd like to raise awareness of people with a visual impairment who are struggling to socially distance themselves. They produce lanyards with messaging to help with that problem. So there's a link on her website, which is www.opensight.org.uk. So that's a comment from Debbie. We've got Abby Twaits. Yeah. Do we know the impact of COVID on other risk groups, e.g. unpaid carers or adults with learning disabilities? Are you aware of any impact in that avenue? Tim Horton, or if not, other colleagues?
I don't have much on the adults with learning disabilities, and Abby, that would be a really interesting one for us to look at a bit further, and maybe others around the room will have comments on that. We do know that on the unpaid carers side of things, that there's been a marked increase in the number of adults that, and indeed there's been a marked increase in some areas in young carers as well, who have had to become carers during COVID and obviously continuing post-COVID. So that whole kind of concept of informal caregiving from family members or somebody that's now becoming somebody's bubble is something that we're mindful of, and probably a need to look carefully at the volume and scale that we've got for carers support going forward. So we do have some evidence of that, but I know not so much about the impact of adults with learning disabilities.
Okay, well, I'm sure we've got some members here who do have. So again, feel free to pop the information in chat, because we will be sharing that information after the session. I'm just having a quick look. We've got lots of comments, so I'm not going to be able to cover everything, but Liz Murray is talking about ICANN therapy centres in Andover, which is in the process of re-establishing. Kerry March asks, other than the obvious social distancing issue, what are some of the other barriers to restarting some of the services? Is there a problem with staffing? So she's flagging that. Did you want to respond to that one, Tim? And that's probably the last question, really.
My apologies, Angela. I was just typing my own comment into the box. So could you just remind me of sorry, which one was that?
The question from Kerry was, other than the obvious social distancing issues, what are some of the other barriers to restarting some of the services? For example, is it staffing? What are the challenges on restarting services?
So it's a number of them. Some of it has been venues and making sure venues are COVID safe and secure. So the risk assessments around that, which obviously there is a lot of support out there, and that in itself shouldn't be a barrier, but it's about the individuals who are responsible for those groups being able to take the advice and guidance and apply it. There have been some funding challenges. Some groups have suffered significantly during COVID if they've had to suspend the service and couldn't find alternative service provision. And not much value in securing COVID emergency response funding, then they may well be struggling financially. What we've also found is that a lot of services of the type that we're talking about actually were run by older volunteers. And whilst during COVID we saw a significant shift and upsurge in younger age group, working age population and younger volunteering, some of those group activities are still reliant on older volunteers coming back. And through a volunteer survey that we did earlier on in the year during COVID, we found that actually quite a significant cohort of people stopped volunteering because they were over 70 or in an age or health category that put them at risk. And some of whom are reluctant to come back to volunteering. So we're just trying to assess now whether that in itself is a barrier. But there's a number of issues there that probably highlight the problem.
Lovely. Thank you very much. So what I'm going to do now is I'm going to stop going through all the chat, because I need to move on. But there is quite a lot of information there. If anyone who's joining by phone wants more information, I'm very happy to share that at the end via I'll read from the chat via the networking, because otherwise there's so much there. It's really, really good information, but I need to move us on. Okay, so I'm now going to hand over to Alex Massey, who's going to talk about the Close Encounters project. Over to you, Alex.
Thanks, Angela. Hello, everyone. My name is Alex Massey from AGK Portsmouth, and I'm here to tell you about the Close Encounters project. Just to confirm early on, the Close Encounters project has nothing to do with alien encounters. That has come up before, so I thought I'll get that out of the way early on. So Close Encounters is a partnership project aimed at decreasing loneliness and isolation for older people in Portsmouth, Gosport and the surrounding areas, including Havant, Waterlooville, Cosham, anywhere between sort of PO1, PO9. The organisations involved in the project are Age UK Portsmouth, Gosport Voluntary Action, who we've got Nikki here today as well, South Central Ambulance Service, University of Portsmouth, who will help evaluate the impact of the service at the end, and Age Concerned Gosport, who support Gosport voluntary action with information and advice, including welfare, benefits, and future life planning for the people of Gosport. There are two main aims to the Close Encounters project. One is an enhanced quality of life for lonely, isolated people within their community. And the second is to help alleviate pressure on the ambulance service, supporting older frequent callers who have no medical need. Many older people contact the ambulance service, whether it be 999 or 111, as they do not know where else to turn. And regardless of it being a medical issue or not, it's really for social isolation. The objectives of Close Encounters: improve older people's access to community support through companionship, information, advice, and advocacy services. Increase community engagement by bringing local people together, enabling them to become more active participants within their community. Make positive difference to older people's well-being, providing resources to enjoy a secure and happy life. So how do we achieve those objectives? So a little bit of background first up. The Close Encounters project began taking referrals in January 2019 and was created to help aid the South Central Ambulance Service, who had been inundated with non-medical related calls from older people. A steering group was created early on to ensure the project was going in the right direction. We wanted to include members of the public that had actually experienced the service to get insight on what parts of the project worked for them and what we could do to improve and help more people with the service that we provide them. Through working with South Central Ambulance Service, a referral system was created for their call handlers and clinicians, and the Close Encounters project was added to their directory of service to drive up those referrals and help as many people as we can. We use services available to us at our organisations to help achieve goals for our service users, such as advocacy services, which Gosport Voluntary Action do amazingly. Befriending and chat groups is another thing Gosport Voluntary Action have done. Chat groups is come here and talk, where befriendees are brought together by their befriender to encourage friendships and relationships between the actual service users. Pre-COVID, seems so long away now, but Age UK Portsmouth had also begun lunch clubs taking advice from GVA's chat groups to encourage those friendships between service users. Befriending is such an amazing way to ensure someone is not feeling alone or isolated. But if these service users can actually create their own friendships, that would be even better, because they're not relying on someone to do a visit or a volunteer dropping out or being unable to continue visiting them. We also facilitate support by accompanying older people to events or services they would not have the courage to attend otherwise, or just signpost to things that they would enjoy that they are unsure where to find information for. The service also enables older people to access a wide range of benefits and entitlements, including assisting with form filling, which can obviously be very difficult for older vulnerable people. So just a few of the outcomes so far. 714 people were referred for help in Gosport and Portsmouth in the first 18 months. That has, we have seen an increase, obviously, post-COVID or in the middle of COVID. Over £1 million of life empowering benefits were secured, which is just, especially during the time of COVID, where people were unsure when they were going to get the next paycheck, and even older people weren't sure what they were entitled to. That was, it was very important. And we've managed to achieve 516 goals. We've got a further 200 in progress. Some of these goals have been difficult to achieve due to the fact that things shut in, like we were discussing earlier. But we still want to work with them. We want to give them the information so that when these things are open, we can help them get there. Of course, with COVID-19, we had to alter the service slightly and support older, vulnerable people the best way that we can, while also keeping everyone safe. We've done that by working with Hive to create and distribute free emergency food parcels that went across Portsmouth. Creation and distribution of activity packs. These include grow your own herb kits, puzzle books, playing cards, NHS approved exercises, amongst a whole range of other things. So obviously, if there is anyone within the remit of Close Encounters, please let us know and we'll get these activity packs to them. We've continued with welfare calls and telephone befriending in lieu of visits being possible. Gosport Voluntary Action have been working with Gosport Borough Council with their COVID-19 response calls and help with their dustbuster service. We've continued helping with telephony support for benefits and form filling over the phone where possible. And Age UK Portsmouth have helped distribute 733 food parcels and have done over 263 hours of welfare calls since the beginning of COVID as well. That's sort of it from me. It's nice and short and sweet for you, to be honest. these slides will be available for distribution, as Angela said earlier, and I'll include a case study for everyone to have a look at and see what we've done. I'm happy to answer any questions, or if you would rather, my contact details are available on this presentation as well. So please feel free to send me an email with any further inquiries or questions that you've got. Thank you very much.
Thank you very much, Alex. And we've got some information again. The PowerPoint will be shared. So all of this useful information that Alex has got on his PowerPoint will be shared. So thank you very much indeed. So again, if you could use your chat, or if you're joining by phone and you'd like to ask Alex a question, I'm going to give you a minute also just to jot anything into the chat box if you'd like to. Anyone by phone would like to ask anything, please feel free to do so. There's a lot of information. You did really well, Alex. A lot of information covered. Thank you. Okay, so we have a question about, in regards to the befriending, is it with the same person the person befriends with, and is it for a set period of time, Alex?
The befriending is, we will match them up. So we will ask them, you know, their likes and dislikes and things like that, so we can create a good relationship between the two. And as long as the volunteer is still happy to continue befriending, they will continue to befriend that person. It would only change if, you know, there was some issue between them or the volunteer dropped out, but we would try and keep them together as long as possible.
And is there a time scale? Did you say there's a time scale?
No, not with the befriending. Obviously, as part of the close encounters, it is a 3-month intervention to get those goals fixed. But once the befriender is matched, then that befriending can go on for as long as the client deems necessary or sees fit.
That's lovely.
I can see Joanne's question as well. Is it face-to-face? We are in the midst of trying to get that sorted. As Tim said earlier, there are various things that are in the way. Obviously, we're currently doing risk assessments and things like that. Of course, working with older people, a lot of them were shielding. So they were even more inclined to stay away or remain a little bit concerned about it. We're hoping to get out and start doing those face-to-face befriending visits as soon as we possibly can. Other services at Age UK Portsmouth are doing home visits, though, the more, you know, for lack of a better word, essential services. So the help around the home, the cleaning, the washing, the shopping, that's all visits are happening with the appropriate PPE and social distance, of course.
Thank you. Nikki Staveley, would you like to give an update about GVA's face-to-face and where we're at with that? Just checking. Are you okay releasing your mic? Okay, I'm not sure if we've got a technical issue there, so we can pick that one back up. I mean, I know from my experience on the fringe of GVA, I know that there's a lot of discussions about, we're doing a lot of risk assessments at the moment. Oh, Nikki, if you scroll towards the lower part of your screen, the mic, you can either do the control, you've got two options really for your mic. I can just see your comment there, sorry. You've got two options to release it. You can either use Control and D, or if you roll your cursor towards the bottom of your screen, you should see a little microphone, and you just click on that and that will release it. Don't worry if not, I'll carry on. What I was saying is, I know that there's quite a few risk assessments going on. There's a waiting list for something like 80 people who want face-to-face befriending. So there is a huge waiting list at the moment, but we are transitioning. Surgery signposters are starting for GVA, are starting to offer a face-to-face limited appointment only service, and that starts next week. Age Concerned Gosport, which is based within GVA, is offering a limited face-to-face appointment service only starting next week. So I would say, no worries, Nikki can't release the microphone, but I would say we're working towards that level. So we're not quite there, a bit like Alex, but we're getting there. Okay, I think that was the last question, if I'm right. Yeah, so what I'm going to do now is move on to the next guest speaker. So if I could invite Peter Stokes, please.
Hello, everyone. I'm Peter Stokes. I'm a Strategic Development Manager in Adults Health and Care for Hampshire County Council, working specifically on the demand management and prevention programme. Today, talking about the impact in terms of what we've been working on social connectivity for a while, maybe not doing direct work, but kind of liaising and making sure that services are joined up and meeting our needs. From our perspective, we're looking at loneliness. We know it affects all ages, as Tim said, and are interested particularly on the population where it begins to impact and increase the likelihood for social care. So often, although that's at all ages, it can often be for those, as Abby's highlighted, with learning disabilities, also those unpaid carers or family carers or friends, and also older adults as well. So what we've done during the COVID period is we undertook, or some of my members of staff undertook, a SWOT analysis by speaking to not only our grant funded providers, but also by taking a good sample of what's out there in terms of those connection activities and those sort of ongoing activities, or maybe activities that are suspended, to find out what's going on and to understand the picture. So we've kind of compiled a SWOT analysis to go through today. With this, I'm not going to go through every bullet point, but you can always pick up things in the questions with me afterwards. But in terms of the strengths, the point I was going to highlight from this one is what COVID has given us is it has enabled us to connect and identify with vulnerable, previously unknown people who are socially isolated and lonely. One of the issues with dealing with this cohort of people is being socially isolated. Often they don't come into contact potentially with other agencies such as ourselves. And through like the Enhanced Help for Vulnerable sort of Telephone 9 and also connecting with other services, it's become, some of those people have become more available, more identified to us, which is really useful. It shows that we can now support them, but also we can look at identifying that group a bit more, having better understanding about that group as we move forwards. So one of the things, and also I think the other positive thing, as Tim has said, is the amount of community and voluntary services who adjusted their service to enable us to do it, and has been evidence also in the chat, as I'm sure you've all been reading. So if we move on next to the weaknesses, no, to the threats, sorry. The point I'm going to highlight with this is it's kind of the point I want to make is on the over-dependence of the befriender. And for that, isn't saying befriending hasn't got a good role, it has. But in terms of where we're seeing it, sometimes we can understand that, especially post-COVID or in a pre-COVID, often if there's only about one-to-one relationship, it can be quite a lot of dependence on that one individual. And we want to look to see how it can be spread more widely, so there can be better, more social interactions with other people. And that kind of links into what was Alex was saying previously regarding sort of a chat and that come here and talk, bringing people together to enable that to happen. So there's one thing which has developed over COVID is actually there's been a lot of one-to-one telephone support, and it's how can we broaden that out to a wider range of people. Equally, as Abby kind of raised in her question, we're aware that unpaid carers have been managing independently, and although they've been managing through this period, as it continues, that can't continue. They are coming to us and saying we can't continue without that support. In terms of statistics, we haven't got statistics on that. We know it's an increased group we're getting from hearing from our carers representatives who are on our sort of caring strategy board and other sort of such groups, and for other agencies we work with. So in terms of weaknesses, some of these are repeated on our weaknesses, but two I wanted to highlight. One is increase in mental health issues. As Tim's highlighted, this is very much the impact of social isolation and loneliness is very much a key issue. But what we've also noticed, what's been difficult, is for volunteers potentially to have the skills to cope with the increase of issues they are facing in terms of the people they're supporting. And one of the things we're considering is how best and how we can work with other agencies and yourselves, what is best and what's required to kind of either support the befriender or to make sure that the referral routes are known about and explored, so that people can get support and it's not always left to that befriender or that person offering that support. The other key element is the digital exclusion, especially for the older adults. Tim mentioned the importance of digital, but we know, and it has been really great. And one of the areas we know one of our providers is, which we do fund, is MHA, which I know was in the comments in terms of the work they've been doing, not only in terms of moving some of the services online in their sort of areas, but also offering those services out across the county. So maybe cheerleading, rather than just happening in the Eastleigh area, it's been now opened up and more broader to the rest of Hampshire, so that people can join. But equally, have people been joining those services, or is it more about local connections? We're exploring some of that at the moment. But we also know that there's a whole group of people who for a lot of reasons can't get on the internet, maybe don't have access to the internet, or maybe don't have those skills. And we're starting to explore what we can do to increase that. We know that other agencies, other councils, and also those sort of voluntary sector are looking at that. So we know it's going to have to be a unified approach. If we just move on to the opportunities, as we've said, we know there's been good work going on. We want to build on those services and make sure it continue to work on what we've learned during this period and trial some of these new ways of working. I think equally, the other thing is, as Tim's been saying, it's been highlighted with some of the questions, we need to manage carefully and work with others and work with the wider voluntary sector and how we manage that transition from those sort of from like telephone befriending, those services that have kind of developed in this time, as we move back at some point to that face-to-face, and make sure there's not a gap in between where people are lost. I don't think that's going to happen, but just make sure we're aware of that and kind of build on the great work that's been done. I think the other key thing is to kind of capitalise on the great community awareness which has grown up regarding this. We've had a lot of neighbours helping neighbours in terms of this project, and actually that's kind of helped reduce social isolation. But I think people are more aware of this as an issue than ever before. And actually, we're thinking about what we can do to kind of spread that message and use that message to kind of to decrease social isolation by using the wider awareness of the issues amongst our Hampshire residents. So in terms of next steps, we can't do this on our own. And this isn't a county council-led project. This is more like something we're coordinating from our end, but we really need to work with all our partners. I've listed some there, but I'm sure there's more, including some, I'm sure, in the private sector as well. And the areas for us and our focus are making sure we have that re-engagement of those in terms of that connectivity, making sure services are engaged, but also those services don't end don't end without other people don't end and allow people to kind of move on to support to other areas. I think the other areas, obviously I've mentioned before, is increasing digital connectivity, and lastly it's communicating new service offers. So when services have started or maybe have adjusted in this period, making sure if we're aware of it, we can kind of advertise it via Connect Support and other means. So on the last name, we'll go on to questions in a minute, but also if you've got any questions or any further triggers when you kind of looked at this beyond this session, they're the two names. My name's on there, my email. Also Alexia, who's my member of staff who's working on this and is kind of really leading this project from a delivery perspective. So either of us, please let us know your comments. We would really be interested in hearing what you're saying, or particularly any gaps you're coming across. We know there may be some prescriber groups, as Tim said, there's less services there, and it's good to understand that so we can look to how we can all work together to facilitate that. So
thank you very much, Peter. So I'm very aware that we're maybe having a few questions in the chat. So again, if you're by telephone, you're joining. If there's anything you'd like to say, please say it now. If you would like to ask or make any comments for Peter via chat, if you could drop them in now, I'll have a quick look. We've got a couple of minutes before we move on to our last guest speaker. So I'll have a quick look. We've got a question from Anne-Marie. Peter, how have you managed to get around digital exclusion other than phone support calls?
Well, in terms of we're not, so we delivering the services to make it clear, other people are. That's one of the main things in terms of that digital exclusion. We do know that there has been people who have been doing as doorstep stop visits, may not be going into the house, but almost isolated, kind of contact through an open window. There's been those examples we're aware of, as well as kind of meeting on that doorstep, socially distancing before. So there has been occasions in community doing that, which we're aware of. In terms of other areas, what we're looking to now is kind of a wider piece of work of how we can kind of increase that digital inclusion. We know that it's maybe about, one of the things we've been talking about is various different things about how we can kind of increase digital skills, increase access to digital technology, maybe through learning, use of those with skills to kind of pass on those skills. But one of those is also knowing that family members who can go into the houses of their relatives, maybe producing a guide for them to kind of help on what's the kind of key elements and what might be useful to kind of teach the person who may have those limited skills, and make it almost like an online ability guidance for them to kind of enable that to happen. So there's some of the things we're considering, but it's early days and we will be working as we go forward.
That's super. Thank you. We've got a question.
Sorry,
Sam,
can I just ask a question too?
please do.
When you're
Yep.
ready.
Yep. Over to you.
Oh, right. Okay. Sorry, Peter, we are providing some service. Don't forget New Forest Community Connectors. I'm also part of demand management prevention. And although we only operate in the New Forest area, and it is just a one-year pilot at the moment, one of the challenges that New Forest Connectors are doing is obviously the groups that we were connecting people with, as previously been said, are struggling to get up and running again. So a piece of work that myself and Marjana are doing is that we are contacting the different groups to find out what those barriers are, but also to find out, because obviously groups and activities have morphed and adapted to our current climate and are operating in very different ways. Some are not operating at all. Some are planning to roll out their activities over the next few months. So we're collating that information because although digital inclusion is extremely important, we have a large cohort of service users who are now scared to leave their homes. And we need to be physically encouraging people to leave their homes, get out there again and maintain their independence. So that is a piece of work that myself and Marjana in the New Forest Community Connector Service are doing.
That's great. Thank you very much.
It wasn't really a question. It was just me jumping on your bandwagon. Yeah,
that's fine. Thank you for sharing. I've got two questions I'm going to combine, Peter, and then I need to move on.
Sure.
One of them is from Sam. Sam Agnew from Brendan Care would certainly like to engage with you, which is great. I'm going to combine Julie's question and Nikki's question. The questions are, when are the day centres likely to open? And also, is there safe support likely to be offered through discovery centres, for example, for vulnerable and older people?
So in terms of the first question, in terms of Julie's day centres likely to open, there are day services are starting to open now. It depends on, but with limited capacity. So it depends on where they are. I know one is coming online next week, I believe, and we've got others to follow later this month. So it is happening. What's happened, there will be limited capacities. Not everyone will be going back to those, although everyone's been contacted. And if they're not going back directly into a day centre, there will be continued provided support by that day centre. It's an emerging picture as conditions allow. Sometimes it's been about finding buildings. We've got a whole commissioning team working on that structure. In terms of Nikki's question, to be honest, I don't know. We have a meeting with libraries tomorrow to discuss this. In terms of, we have been having conversations, but it will be one thing I'll be picking up with them. So it's something I don't know now, but I may be able to feed back to a later date.
Okay, Peter, well, you're in great demand. I can see another couple of questions. So I'm going to give you the homework of answering those via chat while I introduce our next guest speaker, who is Kelly Payne. And the speech is, or the presentation is, The Psychology of Loneliness. So welcome, Kelly. Kelly, I'm just checking your mic. Have you unmiked? Kelly, we can't hear you. Have you unmiked? Okay. We can't hear you. Do you want to try? No. Okay, so do you want to try coming out and come back in? While Kelly does that, then, in which case, Peter, if you actually want to verbally answer some of the questions, we'll give Kelly a couple of minutes just to try. Kelly, give me a shout if you can join us. If not, what I'll do is I'll go through your PowerPoint and let people read it, but you might need to come out and come back in. Okay, so Peter, looking at the question after Nikki, we had Lucy Marder asking, what are your conclusions about the distinctive support needs of younger adults? So, Peter, are you there? if you can unmic. We're doing well today. Okay. Okay, we don't seem to have Peter either. Okay, right, let's just have a look at the comments. Conclusions.
Can you hear me now?
Ah, Kelly?
Hear me now? I logged out and logged
Okay, Kelly, that's great. We'll go back to you. That's fine. Over to you, Kelly.
Sorry about that. I don't know what happened.
That's fine. No problem.
Now that I'm here, I'm the Research and Policy Manager at the Campaign to End Loneliness. Campaign to End Loneliness is just coming up on its 10th year anniversary, and I've been with the campaign for over 5 years. And in that time, you know, I've seen loneliness go from something that people were sort of just thought was for older people and they didn't really quite understand what the problem was, to now there's a government department and loneliness, looking at loneliness, a government minister, and I think most people, it's on the tip of their tongue, particularly with COVID. People know exactly what the problems can be with social isolation and how that can lead to loneliness. We're in a really interesting point at this time, and the work that the campaign has just recently done is looking at the psychology of loneliness, and really understanding what are those psychological factors that influence loneliness. And over 5 years ago, we published our first Promising Approaches framework, which looked at all of the different avenues in which you can address loneliness, and psychological approaches was one of those that came up. So we really wanted to fill the gap in terms of what does psychological approaches what does that involve? How does it what does it mean to approach loneliness from a psychological perspective? There was a big gap in the in the information that we had available about that. So we launched we got some big lottery funding, big lottery funding for this project, and we launched. We commissioned UCL to do a scoping review for us, and then we ran a number of workshops and sort of stakeholder engagement, looking at the results of that study in order to bring together this report. So the report is a result of that work. Just a second. There we go. That's the one I was looking for. Yeah, so this is the report that was just launched in July, looking at these areas. You can move on to the next, and I'm just going to outline sort of the reasons in why we're interested in the psychology of loneliness, and I'll look at what psychological support is available, and then also look at the ways in which we can integrate these ideas into the way that you work as social prescribers. So why the psychology of loneliness is because when we look at the definition of loneliness, it's subjective and unwanted feeling, which results from the mismatch in the quality and quantity of social relationships we have and those that we desire. So it's that unwelcome feeling. It's the notion that loneliness is a feeling. It's something that isn't quantifiable. It's something that qualitative that we feel. The next one, please. Next slide. So we know a lot about the different risk factors for loneliness, but we don't know a lot about how the way in which a person perceives their situation can impact on their loneliness. Next slide, please. So some of the feelings that we can experience when we are lonely these are some of the words people use: as distress, painful feelings, anxiety, helplessness and emptiness, feeling abandoned, not being understood by others, fear and sadness and loss. And this is a much richer view of what it actually feels like to be lonely. Next one, please. And I'm going to introduce this idea of social cognition, and it comes in terms of the approaches that we take in order to address loneliness. And social cognition is the way in which we think about and interpret the situations that we're in and the feelings that we have, and how the scripts in our head that we write in order to tell ourselves the story of what we're feeling or what we're experiencing. And loneliness impacts on those the way in which you use your social cognitions can impact on the way that you feel and your feelings of loneliness. So for instance, there can be a downward spiral. So if you start to feel lonely, it can make you start thinking negative thoughts, and those negative thoughts then make you feel even more lonely. And that spiral, it just goes down and down. But the opposite can happen to take you out of loneliness. Next slide, please. So it's clear that psychology has a part to play, but I'm just going to next look at the different ways in which we can address that. Next one. So there's an overview of approaches, and I won't go into great detail about these. I'll just mention them: cognitive behavioral therapy, mindfulness, and positive psychology. Next one. So cognitive behavioral therapy, again, is using those social cognitions I was talking about before to change the way in which to learn new scripts and to think of new ways of interpreting the feelings that you have or the way that you're experiencing your loneliness. If you can change that through some therapy techniques, that has been proven to work. Next. Mindfulness is another way in which, using techniques around breathing, and there's just a great wealth of information around mindfulness and how it can help you decrease your loneliness. Next one. The other one is positive psychology, which is promoting positive emotions and feelings. And again, this plays into the having those positive thoughts influences how you feel. Next one. So what can be done? Next one, please. I'll just look in, we created this diagram here to show you in terms of the severity of someone's loneliness, the intensity at which the intervention should come in. And we broke it down into population-wide, group interventions, and one-to-one interventions. And I'll go through those. And just to note that the social prescribing mostly fits in within the group, recommending group things. So we'll just move on to the next one. So population-wide, now this is things like having public health campaigns and messaging around loneliness at a larger scale to reach a lot of people, people that aren't so necessarily severely lonely, but people that might not understand what loneliness is, and might not understand the risks, but really introducing to them psychological concepts at a public messaging level. The next one. The next is to shape existing services. So if services that are already running can be influenced to consider the psychology of loneliness and really look at how elements of the techniques that were highlighted, and just the idea and the understanding that within loneliness, you really need to understand the person's experience of loneliness and their feelings of loneliness, and address that some of those things need to be changed before they can start to socialize. And so really understanding that and bringing that into some of the social prescribing context is what we recommend. And I'll just go through the very specific recommendations we made for social prescribing. So we need to know that the knowledge of the risk factors for loneliness can be psychological, in addition to those ones that we already know, which is around the social, the structural, and the things associated with key life changes. So really understanding that psychology is just as important as those well-known risk factors that we're already engaged with. Being aware of the stigma of loneliness and the challenges that talking about it have, and that language can be used to describe the negative, and what languages can be used to describe the negative emotions. So if people come out with certain words to describe the way they're feeling, maybe understand a little bit more that they might be referring to their loneliness. Really imparting empathy, openness, warmth, respect to facilitate the conversation about loneliness. So really using those empathetic skills and trying to understand where a person's coming from. Listening skills are also really important to understand. Really listening to, we call this in this field the person-centered approach. Really understanding where the person's coming from and realizing that everybody's going to be lonely for slightly different situations and different reasons, and you've got to understand the root cause of someone's loneliness. You can't just, it's not one size fits all that everyone's lonely in the same way. Everybody's experience of loneliness is different. And the experience of participant-led discussion using open-ended questions and really building in time to listen to what people have to say. So those are the main recommendations for social prescribing. And I'm just going to go into the third tier, which is going to be another one, is in terms of referrals, making sure that if you know of any one-to-one services for more chronically lonely, so people that are experiencing more chronically that this loneliness that's not shifting, one-to-one interventions like cognitive behavioral therapy. And so with some of those interventions we talked about, like with mindfulness, that can be something that can be taught in a group and people can go through and learn those techniques together. But some people might need that one-to-one support, and that's really the hard edge of of loneliness, where that comes in. Next one. So that's our framework, and I just want to run through some calls to action that we really want people to help us implement the work that came out of this report. After you've read the report, we'd like you to use the information in this report to identify which aspects of your work might be improved by including knowledge around the psychology of loneliness. So really interrogating the work that you do and figuring out where some of these ideas can slot in and where you can alter the ways in which you work to really account for people's psychology. Design future programs to work explicitly include the psychological approaches to loneliness. And last but not least, we say this for any intervention into loneliness, it's really important to evaluate the impacts of these programs on reducing loneliness. And you'll probably know that the ONS has recently, well, within the last couple of years, produced measures, a sort of standard measure of loneliness, the national indicator. So, you know, there are really sort of clear ways of measuring loneliness, and we really encourage people to do that. This will help identify which factors or combination of factors are effective at reducing loneliness, and for whom we can help further develop the evidence base for these loneliness interventions. So we really encourage you to interrogate your practice, figure out where you can insert some of these ideas, and really just start the conversation, get talking, get thinking about how the psychology of loneliness might impact you. Thank you.
Thank you very much. That's really great. And I'm so pleased that we actually got to speak to you in the end, Kelly, which is great. So I'm very aware, because we had a few technical delays, if you have to leave us, we're getting approached to 2 o'clock now. If you can stay, I'm now going to open it up for questions. So again, anybody who's joined by phone, if you have any questions, you can ask them now. There's a lot of information that we've taken in. Equally, other colleagues who are here, if you've got any questions, please drop them into the chat, and we'll just give you a minute or so to do that before we move on. So thank you very much, Kelly. It was interesting you mentioned, Kelly, ONS, because the Close Encounters project uses, I think, Alex, is that right, 4 ONS questions? I think.
Yeah, that's right. There's 4. That's correct. Yeah.
Yeah,
I helped advise the ONS on choosing those.
Brilliant.
Those.
Brilliant.
Yeah. So the first question I see is, what services can you recommend for CBT referrals?
Yeah.
So there's IAPT, which is through the NHS, and that I think you get referred through your GP. But in the report, we've got some case studies of some piloted, mainly big lottery funded, national community lottery funded projects in the Aging Better section, where different cognitive behavioral therapies have been introduced. And I think one of the things about that is that it's very cost intensive. So it's not seen as the most cost effective of cognitive behavioral therapy is seen as the most cost effective of that psychological therapies, but that psychological therapies themselves can be very expensive.
Thank you.
So they've been shown to be very very successful, but they're very expensive.
I noticed a question early on, because Nikki Savely had to go, but she left a question for you, which says, is the campaign to end loneliness going to create some training for group leaders or facilitators so that they can address the psychological issues of loneliness? Because it may be a new concept for many group leaders.
Yeah, that's a brilliant question, and we're just looking at the feedback from, we had an event when we launched the group, and that was one of the ideas, and we're just thinking about how we can possibly take that forward, but that's definitely something we'd like to consider, yes.
Super. Okay, thank you very much for that. That's great. Right, how are we doing? We've got a question from Debbie, so it would be good to link up. She's basically making a comment on how Debbie, and that's from Open Sight, how she can support her clients who are experiencing an increase of anxiety with visually impaired clients, especially where they're struggling with social distancing and not being able to get out and about very easily.
Yeah, I mean, one of the things, like, part of the problem with this work is that it's so new, that this is really the first work that's ever been done on the psychology of loneliness. So this nuance in terms of having exact examples in terms of how you can address anxiety with loneliness, we haven't yet developed those. So we've really just sort of signposted to say, this is something you need to consider, but we haven't been able to bring together a lot of the sort of meat on the bones in terms of how that actually takes place.
Okay, so it's a work in progress.
Yeah, definitely a work in progress.
Yeah, and that's great, and it's great that you've joined us to sort of launch this sort of front end sort of research that you've been doing, Kelly. So I'm gonna draw a line to questions now. If anyone has other questions, please drop them into the chat. But we need to move on because I'm aware of time. So first of all, it's really important that I thank all of the presenters. They've taken time and effort to prepare with me, as Tim Cooling and others will know, and Nikki Ward, etc. They've gone through their time preparation, which is great. Can I say thank you so much to Lynn, who's put a lot of effort behind the scenes. You may not see much of Lynn, but she's the person who sends the invites out, does the administration and the technical side. So thank you very much to Lynn. And particularly, it's been a really lively audience. We've had 4 really good presentations, but really interesting questions, which from my perspective makes a webinar really connected because people are taking the time and trouble to ask the questions. If you didn't have time, obviously we're only here for about an hour or so. If you didn't have time, it's not too late. You can actually email the presenter. All of their email addresses will be on the PowerPoint, and the PowerPoint is going to be accessible by yourselves through Community First and through GVA's website. So you can actually contact that person direct, or you can leave a comment in chat by all means. I'm thinking, and again, please put your thoughts in chat. I was thinking that we might focus on mental health as the theme for December the 1st. But again, we're led by you as members. So if you've got other ideas for the December theme, please pop them into chat. And as I said previously, we also want ideas, your ideas, for 2021. So, for example, what do you think about the webinar approach? I mean, we've got Hannah, who comes over from the Isle of Wight. Possibly other Isle of Wight colleagues have joined us now, but they can't always when it's in Basingstoke and other areas. So we're going to have a planning meeting in October, and I'd like to sort of bring your thoughts and ideas. So please, either via chat or drop Lynn Dudman an email. Could you let us know your ideas for 2021, whether you think a mixture of webinar and face-to-face meetings whenever they restart next year? What do you think about that, please? And we will let you see the webinar, and colleagues who couldn't make it today, from the end of play on Thursday, the webinar will be available on Community First and GVA's websites. Date for your diaries, Tuesday the 1st of December, 1 p.m. Might be mental health, but I could be swayed if I have other ideas coming through email or chat. So I'll leave that over to you, really. And again, share your ideas for 2021. Do feel free now to stay on, and if you wanted to ask one of the other presenters a question, you can do so. You can unmic and you can talk, because this is your networking time. Contact details for their websites are there, and my colleague Lynn Dudman, for those on the phone, it's lynn.dudman@communityfirst.org.uk. So thank you very much indeed. Those that have to go are free to go, and have a good rest of the afternoon. And I will be around I think some of the guest speakers will be around as well. So thank you very much. Having a look at the comments. Okay.